The moment the front door clicks shut, a profound sensory void opens. For many dogs, this silence serves as the catalyst for a biological crisis. Within minutes of an owner's departure, dogs afflicted with severe separation anxiety begin to unravel. They desperately claw at exit points, shred door frames, and emit rhythmic vocalizations that can persist for hours without pause. To understand why this breakdown happens, particularly in small toy breeds like the Maltese, we have to look at how humans designed them. For centuries, breeders deliberately selected for neoteny, the retention of juvenile, puppy-like behaviors. They prioritized extreme psychological dependency and hypersociability over functional independence. This genetic engineering dates back thousands of years. The Greek philosopher Aristotle explicitly categorized this specific type of companion dog as far back as 370 BC, noting its diminutive proportions that were optimized entirely to occupy the laps of patrician society. By deliberately stripping away a canine's independent coping mechanisms to create a constant proximity-seeking companion, humans built a creature completely reliant on a social buffer. When we take that hyper-attached animal and place it into a highly restrictive, isolated, modern urban environment, we trigger a severe evolutionary mismatch. When owners return to soiled carpets or chewed furniture, they often dismiss these actions under the umbrella of little dog syndrome. They assume the dog is acting out of spite, dominance, or simply a lack of basic obedience training. The rapid, high-frequency vocalizations characteristic of small breeds serve as a continuous biological distress signal, broadcast into the silence until the animal reaches physical exhaustion. Because the owners aren't home to witness the panic, and neighbors usually only report the noise, veterinary scientists historically struggled to measure the true severity of the condition. Today, continuous wearable sensor technology allows clinicians to bypass subjective, biased human reports entirely. These sensors use triaxial accelerometers and fuzzy logic algorithms to mathematically track a dog's exact posture in real time. The system autonomously categorizes specific motions, like continuous, frantic pacing, as Level 3 complex behavioral meltdowns. The data proves that treating a destroyed door frame as a simple training failure ignores the reality of the situation. We are looking at a highly measurable physiological emergency. The outward destruction is merely a symptom of a massive internal collapse. Upon perceiving abandonment, the dog's central nervous system enters chaotic overdrive. Advanced neuroimaging shows that dogs with severe separation anxiety suffer from widespread dysregulation in their serotonergic, or 5-HT, system. They literally lack the inhibitory neurotransmitters required to apply the brakes to their own panic. Without chemical brakes, the brain activates the HPA axis. A toxic flood of cortisol pumps into circulation. This chronic overdrive forces the heart into pathological hypercontractility. The left ventricle actively dilates, perfectly paralleling stress-induced broken heart syndrome. Aggressively resolving this panic serves a strict medical imperative. It halts the progressive remodeling of the heart and prevents long-term systemic damage of chronic stress. Despite the severe physical toll this daily panic takes on the body, the veterinary industry is largely failing to treat the underlying disease. A massive retrospective analysis encompassing 32 million canine medical records spanning an entire decade exposes a staggering disconnect between behavioral diagnoses and evidence-based treatments. This chart shows prescribing trends for behavioral problems. There is a massive 8.4% prescription rate for trazodone, an off-label sedative. Contrast that with the bottom. Rates for long-acting antidepressants approved for separation anxiety hovered at less than 0.2%. The profession's reliance on chemical restraint to simply quiet a barking dog leaves millions of highly expressive small breeds without the daily neurochemical support they actually need to achieve psychological relief. True relief requires raising the neurochemical threshold for panic using one of two FDA-approved mainstays in veterinary behavioral medicine, fluoxetine, an SSRI, and clomipramine, a tricyclic antidepressant. Fluoxetine targets the serotonin deficit directly. Spatial cognitive tests show that it functions as a true antidepressant. Over several weeks, it actively normalizes a dog's internal pessimistic bias, shifting how they process ambiguous environmental information from negative to neutral. Clomipramine acts on both serotonin and noradrenaline. It excels at rapidly shutting down the physical motor panic, the frantic tasing and scratching, effectively doubling the amount of time a dog spends in passive resting behaviors when left alone. But clomipramine comes with a severe structural vulnerability. It requires a rigid 12-hour dosing schedule to maintain steady blood levels. If an owner misses a dose or attempts an abrupt withdrawal, the dog will often suffer a rapid and devastating behavioral relapse. Fluoxetine carries its own specific danger, particularly for the Maltese. Its primary side effect is severe appetite suppression. For a tiny 3-kilogram toy breed with virtually zero glycogen reserves, drug-induced anorexia can quickly precipitate fatal hypoglycemia. While these pills stabilize the biological substrate, they cannot teach an isolated dog the skills required to navigate a silent house. That neurochemical stabilization must be explicitly paired with a streamlined, highly compliant behavioral modification protocol. The core of this therapy is systematic desensitization. Handlers repetitively expose the dog to pre-departure triggers, like putting on work shoes or picking up keys, without actually leaving the house. This repetition slowly breaks the learned association between those specific cues and the trauma of isolation. This is reinforced through counter-conditioning. Providing the dog with a high-value food-stuffed toy specifically during absences gives them a clear, actionable directive. The physical acts of licking and chewing mechanically engage the parasympathetic nervous system, actively competing against the sympathetic panic response. Over months of consistent training and proper neurochemistry, the frantic pacing ceases, replaced by a complete return to emotional and physiological homeostasis. By abandoning dismissive myths and embracing objective data, we can stop treating separation anxiety as a training failure. Through targeted medicine and structured patience, we can restore the physical health of the animal and preserve the integrity of the human-animal bond.